Hi friends, welcome to the channel The Nurse. Here we are discussing about pediatric nursing. So in that pediatric nursing, it is a vast subject. So I have divided into mainly three topic I have selected and questions from that topics only. So before going to the topic, if you are not subscribed to our channel, please subscribe and don't forget to share with your friends. So we'll move to the topic. MCQs on pediatric nursing. In that, growth, feeding, birth related conditions we will discuss here. First question, which of the following is a common feeding problem in young children? Overeating, food refusal, rapid chewing, excessive drooling. So correct answer here, food refusal is a common feeding problem in young children. Food refusal is common due to developmental phases, taste preferences or teething. So there are another common problems also there. So I will mention important ones. First one I have already mentioned, that is food refusal. Child may refuses to eat certain kinds of foods or all kinds of food. There is another term, picky eating. Preferences for a limited range of foods, reluctance to try new foods. They may be selective in certain foods. Then another one, feeding aversion. Fear or dislike of eating, often due to painful experiences, that may be GARD or choking, that is esophageal reflux. So that also will cause fear or dislike of eating. Then another problem is slow eating. The child may take unusually longer period of time. Then gagging or vomiting during meals. It can occur due to sensory issues or medical problems. So there will be medical problems for that. It may cause gagging or vomiting during meals. Then another one common issue, that is disruptive mealtime behavior, that is throwing food, crying during eating or refusing to sit during meals. These are the disruptive mealtime behaviors. Then overeating, consuming excessive food quantity through less common, uh, even though it is a less common in toddler, but it is also one of the problem. Then texture sensitivity, that is refusal to eat foods of certain textures, that may be crunchy, mushy. These kind of foods the children may refuse. Then failure to transition to solids, delay or difficulty moving from liquids to semi-solids. Then nutritional deficiencies resulting from chronic poor intake or selective eating habits. Then finally, underlying medical causes, GERD, allergies, oral motor dysfunction or developmental delays. These are the common issues in children. Then second question, a child consistently prefers only a few specific foods. This condition is referred to as food neophobia, picky eating, failure to thrive, gastroesophageal reflux. So I have explained this thing in previous slide. So you can give your answer. So correct answer is picky eating. Picky eating means a child consistently prefers only a few specific foods. It is characterized by a limited range of preferred foods and reluctance to eat, try new ones selectively to foods, certain kinds of foods. Limited variety of foods, the certain features of picky eating, that is limited variety of food, preference for only a small group of familiar foods, then refusal to try new foods, strong resistance or anxiety towards unfamiliar taste or textures. Food jacks, eating the same food repeatedly and then suddenly rejecting it. Then preference for specific textures or flavors, choosing foods based on certain textures, that may be crispy, soft or taste, that is certain kinds of taste, sweet or bland. Then sensitivity to food appearance, reacting negatively or changes in food color, shape or presentation. That child may be very much selective, even though their appearance also they may uh, uh, after seeing appearance also they may react. Then long meal times or complete refusal. Meals may take a very long time or the child may refuse to eat altogether. Then emotional outbursts during meals, tantrums, cryings or frustration when presented with unwanted foods. Nutritional imbalance, risk of vitamin and mineral deficiencies if varieties is severely limited, because the child is taking only selected foods, it may cause nutritional deficiencies. Normal growth patterns usually maintained. Despite selective eating, many picky eaters continue to grow normally. Growth retardation will not be there. Often peaks between 2 to 6 years. It is commonly picky eating seen in 2 to 6 years, a typical phase in toddler and preschool development. Third question, according to IYCF guidelines, exclusive breastfeeding should be practiced for the first 3 months, 6 months, 9 months, 12 months. So what is IYCF? So if anyone knows, you can comment it below. So here correct answer is 6 months. Exclusive breastfeeding should be practiced for the first 6 months. So I will explain key features of IYCF guidelines. IYCF means infant and young child feeding. So they have given certain guidelines to promote the health and well-being of infants and children through appropriate nutrition practice. So that may include infant should be exclusively breastfeed for the first 6 months. That means providing only breast milk without any other foods or liquids including water. Breast milk provides all the necessary nutrition, nutrients, antibodies and growth factors needed for the baby's development. Then introduction of complementary foods at 6 months. After 6 months, complementary foods should be introduced alongside continuing breastfeed. Food should be nutritionally adequate and safe and should be appropriate for the child's developmental stage. And another thing is responsive feeding. Responsive feeding also recommended by IYCF. That means caregivers should respond to the child's hunger and fullness cues. This helps to ensure the child is fed adequately and encourages positive eating habits. And another thing is adequate intake of micronutrients. The IYCF guidelines stress the importance of providing infants and young children with adequate micronutrients that includes iron, zinc, vitamin A, etc. to prevent deficiencies. This can be achieved through appropriate complementary feeding. Then another important point in IYCF guidelines, that is safe and appropriate food preparation. Foods should be prepared and stored safely to prevent contamination, and caregivers should practice good hygiene such as washing hands and ensuring clean utensils. Caregivers should avoid foods that are not safe or nutritious for young children such as honey for infants under 1 year due to the risk of botulism. So first one, that is exclusive breastfeeding for the first 6 months. Then introduction of complementary foods at 6 months. It can be introduced at 3 months also, but 6 months, after 6 months it is mandatory to introduce the complementary foods. Continued breastfeeding beyond 2 years. Some doctors or some pediatrician recommends the continue breastfeeding beyond 2 years. Then responsive feeding, that is according to the child's need or after stopping after fullness of the breastfeed. Adequate intake of micronutrients, I have explained that. Then safe and appropriate food preparation, that is based on child's age and growth. Gradual introduction of solid foods. Avoiding feeding bottles. So that is one of the important thing, avoiding feeding bottle because it may cause some developmental problems. So that we will explain in coming question. Then maternal and caregiver supports. Then 10th one, promotion of local foods. So that is also important because local foods can be easily available. So that is very important to introduce in child's uh, uh, nutrient requirements. Then fourth question, a 4-year child is admitted with acute gastroenteritis. Which type of dehydration is most common in children? Isotonic dehydration, hypertonic dehydration, mixed dehydration. So in this condition, acute gastroenteritis, there may be a chance for isotonic dehydration. Isotonic dehydration, that is where water and electrolytes are lost equally. It is the most common type seen in pediatric gastroenteritis cases. Then fifth question, which of the following is not recommended in the IYCF guidelines? So we have discussed all 10 guidelines that is recommended by IYCF. So in that, which one is not recommended? Bottle feeding, responsive feeding, exclusive breastfeeding for 6 months, timely initiation of breastfeeding. So correct answer here, bottle feeding. Bottle feeding is not recommended by IYCF guidelines. Avoid feeding bottles. The use of bottles, especially those with nipples, is discouraged as it can increase the risk of infection and improper feeding. So that is a reason for avoiding feeding bottles. It may cause infection and improper feeding practices. Then sixth question, a newborn with Erb's palsy typically has an injury to which area? Brain, spinal cord, brachial plexus, hip joint. Correct answer is the injury will be on brachial plexus. So here you can see the child's posture. So there is a name called this posture. Can you comment it below? The typical posture seen in Erb's palsy. The key points for Erb's palsy include, first we will discuss a definition. It may be due to brachial plexus injury causing arm weakness or paralysis. Cause mainly due to excessive pulling during difficult childbirth. Signs, that is weakness will be there or paralysis will be there. Weighted stiff position, loss of sensation. So this is an important position seen in Erb's palsy, weighted stiff position, that is seen in that previous picture. Diagnosis that is usually done with the clinical signs, electromyogram or MRI. Treatment that will be include physical therapy, surgery if needed. Prognosis usually mild to moderate cases, recovery will be there. In severe cases, may need ongoing therapy. Prevention that may include safe delivery practices. Seventh question, cephalohematoma in a newborn usually resolves within 2 to 3 days, 1 to 2 weeks, 2 to 6 weeks, 2 to 3 months. It usually resolves in 2 to 6 weeks. So what is cephalohematoma? I will explain some key points for cephalohematoma. Definition, that is blood accumulation between skull and periosteum. So caput succedaneum and cephalohematoma, that is different condition. So in cephalohematoma, blood accumulation between skull and periosteum. So that is why it is not crossing the suture line. But in the case of caput succedaneum, it will cross the suture line. But cephalohematoma, it will not cross the suture line. The main cause of cephalohematoma, that is pressure during delivery. That may be a forceps delivery or prolonged labor. Signs including swelling on one side of the head or no skin discoloration. Diagnosis usually done by clinical examination. Treatment, that is resolves naturally within weeks to months. 2 to 6 weeks. Prognosis, it is an excellent prognosis will be there. Usually no complication. Prevention, proper delivery management to avoid head trauma. The next question, which factor is a common cause of birth asphyxia? Prematurity, shoulder dystocia, breech delivery, all of the above. So here correct answer is all of the above. All the above are factors for common cause of birth asphyxia. What is birth asphyxia? So I will explain some key features of birth asphyxia. Birth definition, that is failure to establish breathing at the time of birth. Major cause of early neonatal mortality, that is birth asphyxia. Commonly results from complication during the childbirth or delivery. Assessed using UPCAR scoring and fetal monitoring. So at what time UPCAR score used to do? So that you can comment it below. Then key features continues. It can lead to multiple organ dysfunction, especially affecting the brain, heart and lungs, because these organs are mainly depends oxygen supply. If birth asphyxia is there, they will lose the supply of oxygen. Then the functioning of brain, heart and lungs will be impaired. It requires immediate intervention, including neonatal resuscitation. Risk factors include maternal conditions, delivery complication and fetal distress. So in all three ways, it may leads to birth asphyxia. Prevention focuses on improving maternal care and timely medical intervention. So we will move to next question. That is, cleft lip and cleft palate occur due to the failure of fusion during which embryonic period? 2 to 4 weeks, 4 to 6 weeks, 6 to 10 weeks, 10 to 12 weeks. So correct answer is 6 to 10 weeks. Cleft lip or cleft palate, that is a facial structures fail to fuse properly. So that is usually occurs at the 6 to 10 weeks of embryonic stage. Congenital conditions affecting the upper lip and roof of the mouth. So it may fail to join together upper lip or palate. It can be unilateral. Sometimes it will be one side only. Sometimes it will be bilateral. Both sides it may happen. May involve only the lip or sometimes only the palate, or cleft lip and cleft palate, both will be there. It can cause difficulties in feeding, speech and dental development. Often diagnosed at time of birth or via prenatal ultrasound. Surgical correction is typically required for functional and aesthetic improvement. Associated with genetic and environmental risk factors, including maternal smoking and certain medication during pregnancy. So this may cause into cleft lip or cleft palate. 10th question, which of the following is a neural tube defect? Spina bifida, cleft lip, congenital diaphragmatic hernia, tetralogy of Fallot. So it is an easy question. Correct answer is spina bifida is a neural tube defect. Neural tube defect that results from incomplete closure of the neural tube. Congenital defects affects the brain, spine or spinal cord. It occurs due to improper closure of the neural tube during early fetal development. Common types includes spina bifida, anencephaly and encephalocele. Neural tube defect linked to folic acid deficiency during pregnancy. So that is why we are supplying folic acid during antenatal period. It can lead to neurological impairments, mobility issues or fatal outcomes. Prevention include adequate folic acid intake before and during pregnancy. Diagnosed through prenatal screening and imaging techniques. Management varies based on severity, ranging from medical support or surgical intervention. Next question. Which measurement assesses nutritional status under 5 years? Height, weight, mid upper arm circumference or MUAC, chest circumference? Correct answer is option C, mid upper arm circumference, MUAC. This is the scale or measurement tool that is used to measure the mid upper arm circumference. Quick MUAC, that is a quick method to assess malnutrition. MUAC allows for quick identification of malnourished children, especially in emergency and community settings. So it is anybody can easily use this tape. It effectively detects severe acute malnutrition or SAM. So there is another question may ask, what is the full form of SAM? That is severe acute malnutrition. Another short form, that is moderate acute malnutrition, that is MAM. So we can find it out, SAM or MAM, SAM or MAM. So MUAC, that requires minimal training and equipment, only color coded measuring tape is needed. MUAC is a non-invasive and low cost material. So there is not that much cost is required. So it can be easily used everywhere. Low MUAC score is strongly associated with the increased risk of mortality in children under 5. So that is the importance of measuring MUAC. If the score is low, then there is a chance of increased risk of mortality in children under 5. It helps to track progress during treatment for malnutrition. After finding out malnourished children, the healthcare workers will start a treatment. So it is also helps in the assessment of progress of malnourishment treatment. A child is considered stunted if their height for age is above +2 standard deviation, between +1 and -1 standard deviation. SD means standard deviation. Below -2 standard deviation, below -3 standard deviation. So correct answer is below -2 standard deviation is considered as stunted. That is, while assessing height for age, the report came below 2, that is considered as standard. So I will briefly explain about the measurement. Importance of height for age measurement. Height for age reflects long-term nutritional deficiency and poor health conditions over a longer period. A child is considered stunted if their height for age is below -2 standard deviation from the WHO growth standard median. WHO has given one measurement tool, that is known as growth standard median. In that, if the child has -2 standard deviation, that may indicate the growth is stunted or impaired growth. It helps identifying children who have failed to reach their linear growth potential due to prolonged undernutrition or repeated infection. Next question. The most accurate method to assess the weight of an infant is digital weighing scale, adult weighing machine, spring balance, length board. It is also easy question. So correct answer is digital weighing scale. Digital weighing scale measures weight in small increments, usually plus or minus 10 grams, ensuring precise monitoring of infant growth. It allows zeroing the scale after placing blanket or cloth to avoid additional weight. So these are the features of weighing in digital weighing scale. It also logs weight reading even if the baby is moving. Usually baby will continuously move other time of sleeping. So after keeping the baby in weighing scale, if the baby is moving also, it will logs the correct weight, or it will keep the correct weight there only. So it will not continuously change based on baby's movement. Next question. The standard method to measure the length of an infant below 2 years is standing scale, stadiometer, infantometer, MUAC, tape. Correct answer is infantometer is used to measure the length of the infant below 2 years. Infantometer is used for recumbent length, that is lying down height. Measurement of infants and young children usually up to 2 years of age. Next question. Newborn hypothermia is defined when temperature falls below 37.5 degrees Celsius, 36.0 degrees Celsius, 35.5 degrees Celsius, 34.5 degrees Celsius. Correct answer is 36.0 degree Celsius or centigrade. The rectal temperature is below 36.0 degrees Celsius is known as hypothermia. Which is not a preventive measure for newborn hypothermia? Immediate drying after birth, kangaroo mother care, early bathing, warm environment. So correct answer is early bathing is not recommended in newborns because it may cause hypothermia. All other methods are used to prevent hypothermia, that is immediate drying after birth, kangaroo mother care, warm environment. These are the measures used to prevent hypothermia in newborns. Early bathing causes significant heat loss that may lead to hypothermia. 17th question. A major sign of hypothermia in a newborn. Excessive crying, hypoglycemia, hyperthermia, increased activity. The major sign of hypothermia in a newborn, that is hypoglycemia. And important thing is, initial stage of hypothermia, there will be excessive crying and increased activity. Then followed by the activity and crying level will be reduced. So that is important. Hypoglycemia is a major complication in hypothermia. In hypothermia, initially increased activity and crying will be there. Later the baby becomes sluggish, weak cry, poor feeding, facial erythema, peripheral edema, sclerema, that is thickening of the skin, pallor, cyanosis, decreased reflexes, shallow or irregular respiration, abdominal distension or vomiting are seen. The main complications include hypoglycemia, metabolic acidosis, hyperkalemia, acute renal failure, disseminated intravascular coagulation, pulmonary hemorrhage. These are the complications of hypothermia, and it is a fatal condition. If it is untreated, the baby may die. So hypothermia prevention is important in newborns and infants. 18th question. A baby weighing less than how many grams is classified as low birth weight baby? 1000 grams, 1500 grams, 2000 grams, 2500 grams. So correct answer here 2500 grams. If baby weighs less than 2500 grams is known as low birth weight babies or LBW babies. 19th question. Which is not a common cause of low birth weight? Maternal smoking, maternal infections, prolonged gestation, maternal malnutrition. Correct answer is prolonged gestations. In prolonged gestation, there will be big babies, but in the case of maternal smoking, maternal infections, maternal malnutrition, there is a chance of a low birth weight baby. So prolonged gestation usually results in larger babies. 20th question. Best feeding practices for a stable low birth weight baby is IV fluids, formula feeding, exclusive breastfeeding, oral rehydration solution. If baby is stable, there will be exclusive breastfeeding only required to improve the nutrition status. Breastfeeding promotes optimal growth and immune protection. Next question. In caring for a child with pneumonia, the nurse should prioritize administering antibiotics, maintaining airway patency, encouraging oral fluids, monitoring input and output. The main thing is maintaining airway patency when care for a child with pneumonia. The primary concern in pneumonia is impaired gas exchange. Maintaining a clear airway ensures adequate oxygenation. Then 22nd question. Which of the following is the most reliable sign of dehydration in an infant? Dry mouth, sunken eyes, sunken fontanelle, decreased urine output. Correct answer is sunken fontanelle. A sunken anterior fontanelle is a reliable clinical sign of a moderate to severe dehydration in infants due to loss of fluid volume. So, importance of physical examination of anterior fontanelle is required, that is to assess the dehydration status of the child. So that is about today's video. So if you have any doubt, then you can comment it below and don't forget to share with your friends. So thank you for watching this video. Bye bye.